Dr. Justin Skrinsky here with an update on COVID-19. If you find this video useful, consider subscribing to this channel directly for future updates as they come. You may have recently heard all sorts of phrases such as social distancing and flattening the curve. Let's understand what these mean and see what you can do to shorten the duration and minimize the damage of the COVID-19 crisis. Imagine you had to drink a gallon of water. If you had a day or two to do it, it'd be no problem, right? But if you only had 5 minutes, it could turn fairly uncomfortable for you. That's the exact situation we face with COVID-19. The issue isn't necessarily the overall numbers, but how quickly these cases develop. The tragic situation in Italy isn't because the virus is more deadly there, but rather because the medical resources of the country were overwhelmed by a surge of patients, specifically intensive care beds and ventilators for the critically ill. This brings us to today's phrase, which is flattening the curve. When we look at the number of COVID-19 cases in the US, we see a curve like this. This is actually very similar to Italy's. The question is where ours will go. If we all band together and do our part, then the hope is that the curve will flatten, like this, and the number of cases will peak at a very low level before declining. If we don't do what we need to do, then we could see a frightening increase in cases over time, like this. If COVID-19 were simply allowed to burn through the US unchecked, we could have a nightmare scenario of millions of cases. Our hospitals simply wouldn't be able to accommodate the sick. People who would have recovered if given life support while their bodies fought off infection would die for a lack of beds and ventilators. But I don't think that's going to happen because I trust all of you to do what needs to be done. The harder we work now, the briefer the disruption COVID-19 will be to our lives. So what can you do? First off is to stay home and avoid groups and crowds. It's important to remember that 80% of people with coronavirus don't need hospitalization and can recover at home. If you have symptoms, if you have risk factors, if you have any doubt, stay at home. If you're concerned about your symptoms, ask your doctor if you should be tested or go to the hospital. Our understanding of the virus is still evolving, but for now it seems that the main spread is through droplets, little particles of moisture that are expelled when we cough, sneeze, or even just breathe. Currently, the CDC recommends social distancing at a minimum of 6 feet, a distance after which it's less likely for you to contact these droplets from another person. It's rough, I get it, it really is. We're missing weddings, funerals, movies, parties. Let's not even start with work and employment. But old or young, sick or healthy, no one is immune. Anyone can get sick, and anyone can be a carrier. These rules apply to you. Yeah, you. It's unclear how long this coronavirus can survive on surfaces. Some unpublished data suggests anywhere from a few hours to a couple days depending on surface type. This just emphasizes even more the need for good hand hygiene, and for workers such as mail carriers, cashiers, and food delivery people to self-quarantine, and stay home if they have symptoms. The harder we work now, the shorter our hardship will be. Right now, it's unclear how long the pandemic will last. Some have speculated that COVID-19 will dissipate with the warm weather, but honestly there's not much data to say either way right now. That means it's up to us to stand together as a community, even if we have to stand physically apart. You're not going to lose friends because the bar is closed. You're not going to lose your gains because the gym is closed. We can rebuild the economy, but we can't bring back loved ones that we've lost. As always, make sure you get your information from reputable sources such as the CDC and World Health Organization. Panic is never a useful response. Remember, be informed, be rational, be kind, and of course be healthy.